Hey everybody, thank you for joining me tonight. I'll just wait for a few people to pop on in as usual. So as I mentioned on the story I did today, we don't have a fertility specialist with us tonight. I feel like they're all on holidays somewhere warm. Probably everybody's in Europe. It feels like everyone's in Europe. So instead of having a fertility specialist tonight, you guys get me. So this is the time, I guess, to be able to answer, for me to be able to answer all your naturopathic questions or your nutrition questions, and we can, make it like super interactive. You guys have loaded up. I've got my laptop here with all the questions, like so many questions on the Instagram stories. So thank you for doing that. I know you guys have so many questions that we want answered. We've got some really exciting practitioners or specialists, I should say, coming up in the next month. I'm just having a look to see the exact dates, so I can give you the exact dates. So for you, those of you who are on the mailing list, the email list, you will already know who they are. And for everybody else, you can join the mailing list somehow. Or I am going to tell you. Okay. So basically tonight, next week we've got a bonus session with Dr. Natasha Andreadis from City Fertility, and she's going to chat about her research and interest in music therapy with fertility, and all of your other IVF questions. She's awesome. She's super supportive. She's really integrative and really on board with, kind of bringing in all of the complementary stuff in with the medical to really get you guys the best results. Our next normal session, normal being the first Wednesday of each month, will be August, and we've got Dr. Anthony Marin from Janaea, who is also amazing. I'm really excited to chat to him. We've got another little bonus session on Wednesday, August 24th with Dr. Bill Ledger from City Fertility. Not everybody can do it on the first Wednesday every month, so I'm just grabbing these specialists when I can. And then definitely mark your diaries for Dr. Alison G. She's Wednesday the 7th of September. Hopefully you guys are all pregnant by then, you don't need to listen, but just in case, pop those into your diaries. I'm also in the next couple of weeks pre-recording a session with Dr. Sonal Karia from Janaea, and that'll be uploaded online, and I'll make sure that I should share the link with all of you. Not all of the doctors have and use Instagram, which is fair enough. So so I'll upload Sonal's session and make sure that you guys get all those links. All right, so any questions you've got, please pop them into the comments, and I'm going to really try to make sure that I'm definitely going through the ones with the people that are joining live, but I'm going to start with the ones that people have sent in. I'm just going to check the little comments. Okay, cool. So thank you for, yours were the questions I was going to start with anyway, whoever that was. Okay. So how to increase progesterone, and do you recommend Vitex? Okay. So progesterone is basically produced in the second half of the cycle, in the luteal phase of the cycle, and a good progesterone level about a week after ovulation is ideally over 30 and ideally above 40, okay? So progesterone, if you've got low progesterone, you're either testing it at the wrong time. We can't tell if you've tested progesterone at the right time until you get your period, and then we can count back a week and go, is that when we checked progesterone? So if your progesterone's under 30 at that time, then it is looking a little bit low. So it's not just a question of increasing progesterone, it's about improving egg quality and the beginning of the cycle, because a good healthy egg will cause enough progesterone secretion. So the question was also, do I recommend Vitex, which is a herb? Now, Vitex can be really useful for supporting progesterone production, along with B6 and zinc as well. It's not for everybody. If you're starting it, you do want to start it at the beginning of the cycle. Now, particularly with herbs, let alone supplements, but particularly herbs, it is better to have somebody naturopath prescribe them to you so that you know if that's the right one. The amount of people that come with a bucket load of supplements and herbs and things like that, but are not getting any results from them, astounds me constantly. And so, look, kudos to you all for trying, and something's often better than nothing. But sometimes you can be taking things that aren't appropriate for you. And then when we're looking at supplements, the sad thing is that most of those over-the-counter supplements and supplements that you buy online, a lot of them have like almost no bioavailability. So we know with ubiquinol, which is really important for egg quality, and we're looking at doses of around about 600 milligrams per day, which is just crazy and expensive. So most of the brands have about a 5 to 20% absorption, which is crazy. I've been using a new brand, the BioClinic Naturals. That one's phenomenal. It's got the best absorption. It gets the best results. So what ends up happening is that people think they've been taking this vitamin E or those fish oils or whatever, but unfortunately you often aren't getting that. And so the Australian ones that are TGA approved, practitioner only, it's not just because we want to give you more expensive vitamins. It's that you know what you're getting, so you're not essentially wasting your money. So Vitex can be good for producing progesterone. Depends a little bit on why your progesterone levels are low. Now, will you get blood work checked on day 19 to 21 to check progesterone? Absolutely. So if that's a week after ovulation, then yes, that's the right time. People come having had their progesterone checked on day 21, but if you've got a 35-day cycle, then you shouldn't be testing that progesterone until, day 18. No, hang on, day 28. Sorry, I can't do my maths tonight. So a lot of people come going, oh my gosh, I'm not ovulating, but it's just that the progesterone has been checked at the wrong time. So if you don't know exactly when you're ovulating, you could use the ovulation P sticks, like the predictor sticks, and then a week after you get a positive, get your progesterone checked in a blood test then. Sometimes we've just got to do a few progesterone checks in that second half of the cycle and then be able to look back after the period comes and go, oh yeah, that was the one that we did on day 7. It's not something you need to get done all the time. If you've got spotting or a short luteal phase, meaning that, from ovulation to period is shorter than sort of like 12 days, it is a good idea to get your progesterone levels checked. Okay. Most ideal blood levels for iron, vitamin D, glucose, and thyroid when trying to conceive. Love it. Okay. So lots of you who see me privately in the clinic or seen one of my other naturopaths will know that, the normal range is not always the optimal range. So vitamin D, I'd be looking at a vitamin D of around about 100, 120. So the range is 50 to 250. So you could be 60 and they'll say that's fine, but you're wanting it around about 100 to 120. If you're in Sydney, we've had the most miserable year in terms of weather. So a lot of us haven't even had our vitamin D from summer. So this is the year that a lot of us are going to be low. But get it checked. If you don't need it, you don't need it. Make sure you stop taking your supplements for around about 5 days before you do a test so you don't get falsely elevated levels or, there's no interference there. For iron, we're looking, say, for example, at ferritin, which is your stored iron. Now, the range is 15 to 250, crazy. I would be looking for at least 40 and ideally 60, but that is hard to get. Thyroid, I'd be wanting your TSH to be under 2 and ideally around about 1 to 1.5. Okay, high testosterone, high DHEA. What does that mean? It's often and usually associated with people with polycystic ovarian syndrome. So if you've got high testosterone, maybe you do have irregular cycles, PCOS, excess hair growth in the bits you don't want it in, maybe acne, and maybe even some hair loss in the bits that you do want the hair in, then it may be that you do have high testosterone. Zinc can be really helpful here. Spearmint tea, crazy. 2 to 3 cups a day of actual spearmint tea, not spearmint flavored tea, not peppermint tea with a dash of spearmint. Actual spearmint tea, which we've got on our website. It's not actually that easy to find. I just use the Planet Organic brand, but you can jump into our online store and grab some if you need it. It's a really simple way and has been shown scientifically to help to reduce testosterone. I also use some beautiful herbs like peony and licorice. Those things are kind of great as well, but again, really should be practitioner only. Okay, just want to make sure I get optimal range for progesterone I talked about. Will you only notice pregnancy symptoms after implantation, or can you notice any changes before implantation? this is the $1 million question that will drive you absolutely nuts. If you're waiting to see, you're either in the 2-week wait for IVF or you're in the 2-week wait for natural, you're trying to ascertain, Google, check, discover, what are these symptoms? Do my sore boobs mean pregnant? Does that little cramp mean not pregnant? Does my slow bowel mean pregnant, not pregnant? I hate to be the one to say it. It all means everything and it all means nothing. So you could have every symptom under the sun and not be pregnant. You could have no symptoms and not be pregnant, and vice versa. So try to, if you can, use this time to really focus on breathing, relaxation, binge a bit of Netflix, really try to kind of stay distracted, try to stay off forums and things like that, because you will turn yourself inside out trying to work out if it's pregnancy or not, when in actual fact, in a week or two, you're going to do a test and that's going to be the only thing that's definitive. So sorry about that. Marianne, hi darling, how are you? Thank you for saying hello. Okay, Lozzie, irregular periods since February and ovulation stopped. What might be causing this? Okay, not great. So if you've had irregular periods, but you've been having super regular periods before that, you definitely want to get that checked out. If you've always had irregular periods and it's gotten worse and you haven't ovulated since then, it may be that you're becoming a bit sort of more polycystic. Now, if that's the case, you've probably already had it a bit underlying. Maybe there's been more stress, maybe there's been more weight gain, which could have affected it. The other thing too is the exact opposite. Too much stress, again, too much weight loss, not enough carbohydrates, fasting. All of those things can cause amenorrhea, which is when you don't get a period, which is basically from not ovulating. So what you really need to do is to have a look at your diet and lifestyle. Have you gained weight? Have you lost weight? You know, could that be a contributing factor? If not, you need to hightail it, no rush, but you know, down to the GP, get your baseline hormones checked, get your thyroid checked, get an ultrasound, and just see exactly what is actually going on. Okay, what have we got here? Do you find most clients that use IVF and had a successful transfer require this for all future pregnancies? No. Bizarre, right? Some people do like 8 rounds of IVF. They're on all of this like immune support and natural killer cell treatment and all these different things that just would feel like there's no way they conceive naturally, right? And then 4 months later, whilst breastfeeding, they're pregnant naturally and don't have any issues, don't need any medication. So the thing with unexplained infertility is that, you know, it doesn't necessarily mean that you won't fall pregnant naturally in subsequent pregnancies. And often once your body has been pregnant, it often does happen. So that's not the case for everybody, but I see that a lot, which is great for those people. Okay, all right. So if you've got any more questions on the live, pop them in, but otherwise I'm going to go through the million. Sorry, I'm talking really fast. A, because I always talk really fast, as you've noticed. And B, I've got so many questions and I really want to make sure that you guys are getting the maximum, bang for your buck, even though it's free, but that's okay. The most time. You guys have spent your time listening. I'll shut up now and just answer the questions. Okay. Trying to conceive with PCOS and very irregular long cycles, is there anything I can do to help? Yes, absolutely. So first of all, it depends on what type of PCOS you've got. So if it's more insulin resistance, then increasing exercise, reducing carbohydrates, looking at working with a naturopath for some specific herbs, looking at magnesium, vitamin B6, zinc, inositol, these things can all help. Really trying to, work on that insulin resistance. Now, the other thing is that you can also have PCOS with high testosterone. And that's when we want to do some of the tips that I talked about before of clearing testosterone. Again, there's specific herbs that can help with that too. There is also kind of adrenal PCOS. So really working on diet, exercise, making sure that you're eating well, going back to my healthy eating mantra of getting a source of protein, some good fats, and something fresh with each meal and snack. If you guys haven't done my 5 weeks to fertility online program or the 14-day IVF support program, definitely jump into my online store. I think the link's obviously probably in the bio. They're only $129 at the moment. You're going to get all the recipes, all the information on diet, lifestyle, meditation, mindfulness, sleep, exercise. It's all scientifically based. So, you can get much more information there if you're not coming for one-on-one appointments. Okay, best prenatals and how soon to start taking. If you're considering conception in the next 3 months or even 6 months plus, I'd be absolutely starting with the prenatals. The ones that I'm using at the moment that everybody's really loving and I'm really happy with the formula are the NaturBest preconception multis. There's the men's one and the women's one. They're not practitioner only, so you can jump into my online store and pop them into your cart, pick them up, have them posted, whatever. You don't need a prescription from me, which is great. And there's also them in combination with what I call the fertility starter pack, which has a really good quality fish oil, a good probiotic, and also the NaturBest in there. We bundle them together to make it a little bit discounted, and you can get started on those. There's so many fertility issues at the moment, and obviously I see fertility issues, so it feels like there's lots of them because I talk about them all day long, but we know that fertility rates are declining. The uptake of IVF, for people in their even early 30s is absolutely increasing. There's so many more issues with egg decline, egg quality issues, sperm quality issues. So, there's never really it's never too soon to start taking supplements to really support your fertility and also your general health as well. Okay, the $1 million question as well. What to do after an egg retrieval to increase your chances of a successful transfer? Now, after you've had the egg collection, a lot of the work really has been done before that on egg quality, sperm quality, looking after DNA, all that kind of stuff. A lot of that's been done. When the time is to come to the transfer, there's sort of things you can do, but a lot of it, again, as I said, has been done. So really, relaxation, not too intense exercise, just walking and rest in that 2-week wait after you have the embryo transfer. We know that embryos don't like a high glucose environment, so you really do want to reduce sugars and excess carbohydrates. Really bump up the protein and the vegetables with each meal and most snacks if you can. Stay really well hydrated. You want to really support that blood flow, really get that, the blood vessels that go into this tiny little embryo, they're thinner than a spider's web. So, you really want to make sure that you are well hydrated. Definitely avoiding caffeine, alcohol, smoking at that time. And then it's trying to kind of get lots of rest, relax, and really cross your fingers. So good luck if you are in that 2-week wait. It's such a stressful time. Okay, here's a 25-year-old Amelia. Oh, where did you go? 25-year-old, you've got PGD tested embryos. That means that the embryos are genetically tested. We know that they've got all the chromosomes. They could possibly become a potential baby. With 3 failed fresh embryo transfers, what to do next? Okay, you absolutely need a really good workup. You need to see a good fertility doctor. That people that I've been interviewing on the series are all really good at kind of working people up. You can also come to somebody like me and we can do that workup for you so that we can identify what might be going on to be causing this implantation failure. Now, the common reasons that I would see is that there might be some sort of blood clotting disorder. So things like factor V Leiden, protein S, protein C, cardiolipin antibodies, phospholipid antibodies, lupus anticoagulant. I see so many people where these things haven't been checked by their doctor. We've identified them. I can't treat them, but we can send them back and then they get given aspirin or often Clexane, which is an injectable blood thinner. The other thing that I'd definitely be looking at for you would be investigating natural killer cells. You can go back to one of my earlier interviews in this series with Dr. Gavin Sachs, who's pioneered a lot of the research with natural killer cells. If you're in Melbourne, Lynn Burmeister will do that sort of similar thing as well. Lots of doctors do it, some doctors don't do it. So I'm often, again, referring people for this test. So that way then we can work out what's going on and then work out which fertility doctor to refer you to and we can work together. There's definitely something going on, so I wouldn't keep doing transfers until all that's been looked at. There's most likely some kind of immune or blood clotting issue that needs to be looked at and can very often be addressed with the right kind of medication, and then potentially, supplemental sort of support as well. Okay, so I'm just checking on the live for questions. That's you. Hi, Amelia. Did all NK cell tests and they're all normal. If you've done normal NK cell tests, if you've done, or like if you have you had a laparoscopy, check if there's any endometriosis there that could be affecting implantation. It may be that you do need to do an endometrial biopsy, and that's looking for any asymptomatic bacteria. You may need a load of antibiotics before you do the next transfer. So getting a hysteroscopy, laparoscopy, you're seeing Dr. Sachs, cool. Yeah. So you're probably doing all of those things. There is also this other kind of little down sort of turn spot where basically, it could be that you've got what's called a DQ alpha match. Now, not all doctors believe in this. The science is not 100% there. But, if you're 25 and you're having all of these issues, I may be investigating the DQ alpha pathway. The person to be seeing for that would be potentially looking to see Dr. Gamal Mathias, who's a reproductive endocrinologist, if you're based in Sydney, because it may be that there is that kind of, imbalance there. So hopefully that gives you a little bit of direction to kind of go on. Okay, so Abby, avoid caffeine during the 2-week wait. Can I ask why? I thought coffee was okay. Yep. So the fertility doctors will often say everything's okay. So the research basically says that 2 caffeinated drinks or foods, so that could be, Red Bull, tea, coffee, cola, dark chocolate even, some of that's really high in caffeine, has been associated with an increased risk of loss. Okay, now that doesn't mean that caffeine causes loss, but if there is an association with an increased risk of loss, and all you guys are here because presumably it's been a little bit harder to conceive than we thought it was going to be, then I would be just eliminating anything that's got that loose association. Don't get me wrong, love a coffee, but just not worth it, okay? So 1 coffee, to be honest, is probably fine. The research was on 2, but they also didn't do that same research with just having 1 caffeinated drink to see if there was an increased risk. So I would just take out anything that we know could be potentially associated. There was even, and this is in my course as well, all this information's in there, that there was a very small, needs to be redone kind of study in New Zealand showing that people who'd had green tea had slightly lower, slightly lower implantation rates in the IVF setting. Again, they could do another full study and it be completely not the case. However, I'm like, do you know what? Let's just not have it. Easy. Do a nettle tea instead. Taste the same. My sort of philosophy on all of these things is just to not have anything that has any association. So let's not wait for the research that says, oh, okay, in 5 years' time, alcohol is bad or coffee is bad or green tea or whatever it is. Let's just not have those things now. So we're minimizing all of those variables. If you're super addicted, just have a weak one. I don't think it's probably the end of the world, but we don't know. Oh, thank you, Marianne. You're gorgeous. Thank you for the compliments. Okay, what do we got? All right. 8 transfers, 3 losses, 6 embryos from the latest egg retrieve being PGD tested. Oh, all my fingers are crossed for you. So I would go back to what I was talking about with Amelia, where, looking at the immune, the blood clotting, the NK cells, looking at thyroid, looking at celiac. I had a patient the other week, no real symptoms, really high gluten antibodies, in for a gastroscopy, ends up with celiac disease. Now, we see this all the time, and it's a big reason why people are not falling pregnant. Can endometriomas on the ovaries cause issues? Where did that go? When trying to fall pregnant? Look, it is possible that is the case. So an endometrioma on the ovaries is usually an indication that there probably is endometriosis. Now, endometriosis, we know, can leak sort of toxic stuff into the uterine cavity and affect egg quality. The inflammation that it causes can also affect implantation. So the endometriomas, they don't like to touch them if they don't have to, because whenever you touch the ovaries, as in go in and surgically remove them, there is a chance, a lot of a chance, that you actually damage the ovary, and that can reduce your ovarian ovarian reserve. So, if there's an endometrioma there, but all the rest of the endometriosis has been removed, then there's a good kind of chance that maybe that's going to kind of be okay. And look, I've absolutely had patients with endometriomas fall pregnant, so it's definitely not a no. However, it may be, a contributing factor to why it has been more difficult. IVF just got cancelled because of COVID. How annoying. Do you advise a wait for a certain period of time before trying again? Older, so I don't have time on my side. Look, you can potentially just do it in the next cycle. So if you only had COVID really mildly, you can do it in the next cycle. The research is still coming out on what the effects of that is, and I think it'll take a while for it to kind of really hit the ground. We know that there is a potential decline in semen for a couple of months after COVID, so if your partner had it too. I definitely have had more than a handful of patients who do a cycle after they've had COVID and have found that they didn't get as good egg quality or egg numbers, but that's a little bit sort of circumstantial, like that's not sort of hard evidence. So most of my patients, or a lot of my patients, we are racing against the clock. Lots of them are 41, 42, 43, 44, and we don't have heaps of time. So if you've got more than one cycle left in you, which I know is a terrible thing to say, but I'm always for the backup plan. If you've got more than one cycle in you and you feel like you are older and you're running out of time, do a cycle now. If you're like, I've only got one more cycle in me, maybe wait a couple of months. Use that to kind of work on egg quality with supplements while you're kind of waiting. But it's not a guaranteed sort of yes or no. Okay, what did you suggest to take or do that would help to treat with Hashimoto's? So Hashimoto's is thyroid antibodies. So that means that your body's making an immune response against your thyroid. The most sort of blanket things I would say to do would be to get onto a really good quality fish oil. Most of the practitioner-only ones are the ones that you want to be going for. As I said, in the fertility starter kit, I've got the MedLab Omega something or other. Gosh, is that a mind blank? Anyway, that's not a practitioner only, and that's why you can buy the starter pack on my website without a consultation. So I've sourced the best of the over-the-counter bunch for you guys to be able to come to access that. So lots of high-dose fish oils, particularly EPA. It's the anti-inflammatory bit that we want, not so much the DHA, which is more the focus in pregnancy. I would be going gluten-free. So we know that gluten antibodies can cross-react with thyroid antibodies and can make them worse. Lots of protein, lots of green leafy vegetables, really important. Bump up your zinc. So that could be from oysters if you're like lucky and going somewhere summery and beautiful. Probably not at the moment. Pepitas like pumpkin seeds. Also look at bumping up selenium. You can absolutely do that from having 2 or 3 Brazil nuts most days. You probably don't really need a selenium supplement per se. So those things are going to help to reduce the inflammation associated with the antibodies. And then it's really important to make sure that your thyroid function is okay. So checking your TSH, your T3, T4, and making sure that those are optimal levels. Okay, who have we got there? Okay, so I'm just making sure. Husband has had COVID, about to go for egg retrieval. Can you expand on the lower sperm count? Yeah, so it's just something that has kind of been shown in some men. It's not in everybody. So if there's been no issue at all with the sperm and your husband didn't have a really strong dose of it, now this is not scientifically based, right? Like obviously all the COVID stuff is like super brand new and its impact on fertility and IVF is kind of like even newer, right? So if there's been no issues with sperm though, like sperm count's great, sperm concentration's great, motility's great and everything like that, that's not why you're at IVF, then you can probably just go for it if your doctor thinks that that's kind of fine. If the sperm count is already low or the semen parameters are already really low, it may be worth waiting an extra month. You can look at things like N-acetylcysteine, vitamin C, quercetin, zinc, vitamin D. So really trying to kind of look at those and maybe even some antioxidants like ubiquinol to really help to kind of like support that sperm count. And particularly if you had it sort of badly. But if you're about to go for an egg retrieval, just not even listen to me, go do it. And I'm sure it's going to be fine. It's not oh my gosh, you should stop. Otherwise the IVF doctors, honestly, they would stop you. They want to get you good results just as much as you, well, maybe not quite as much as you want them, but like they genuinely, all of us that are on your team, genuinely want you all to fall pregnant soon, healthily, however that kind of happens. So if you're about to go for an egg retrieval, you're all good. It's going to be fine. I've got just, bit of good juju out there for you. So no, you're going to be all good. Okay. Hi there, I have no thyroid, so on medication, good. It has been all over the place. Someone else was telling me that the other day too. I'm now gluten and dairy free. Will this help too? Look, often it does. So it depends a little bit on why you've got no thyroid. Have you got no thyroid at all? Is that why the medication's not at the kind of the perfect level? Some people without a thyroid actually also need a bit of T3. So if you're T4, that's the thyroxine or roxin that you're being given, you know, if that's sort of still causing your TSH levels not to be great, make sure they're checking your T3, because some people actually need to be given a little bit of T3. Okay. All right. What have I done? Okay. So I'm going to keep going through these questions. All right. What have we got here? Next page. Okay. Potential reasons for recurrent implantation failure. I think we chatted a bit about that before when we were talking about Amelia's stuff. Prenatal, which is best. Answer that again. What are some ways, and I've had this like so many times today. What are some ways you can help to prepare your uterine lining for a transfer? Now, if you've got a thin uterine lining, right? So not you think it's thin, but the doctor has said your uterine lining is thin, then often they'll be giving you some more estrogen and trying some different medications to actually support the growth of the lining and the thickening of the lining. If it's not thin and you're just worried about it because you're just worried about it, which happens with lots of people, then honestly, like, you don't really need to worry about it. Okay, so definitely lots of water, definitely again looking at fish oils, really important. Often I don't use vitamin E after a transfer, but before a transfer, vitamin E, vitamin C can be fantastic. Arginine can be fantastic as well if the uterine lining is thin. Now, if you don't have a thin uterine lining, don't waste your supplement money trying to make it thicker for the sake of it. Like, thicker isn't better. You just need it to be at the right level. If you go back and listen to, I think it was my chat with Gavin Sachs, he actually has a really interesting point of view where he sort of talks about, you know, yes, it is, you know, important for your uterine lining to be good, but at the same time, sometimes they put embryos back into what they would consider a thin uterine lining because they can't thicken it, and it thickens up as soon as implantation takes place. So it's really hard with IVF because we're trying to control all of these variables, but we're looking at it, you know, in such a kind of microcosm. So if it's been diagnosed thin, look at some of those things that I talked about then. But if it's not thin, but you just want it thicker, it doesn't need to be thicker. You're all good. Okay. We did that one. We talked about that one. Okay. All right. Sorry, I've got so many pages here. Okay. Do I need acupuncture? Yes, I went through that one. Okay, so do I need acupuncture? So if you're into acupuncture, absolutely do acupuncture. A lot of people have like a certain spend of their money. So they might be seeing a physio or an acupuncturist or a naturopath or a nutritionist and things like that. So, you know, whatever you feel like resonates well with you, what helps you. Acupuncture is so good for kind of stress. Some people love it for regulating cycles. So, you know, any of those extras, if they feel good, then I think, you know, then that's going to be a great thing for you. Okay. Can low homocysteine levels affect implantation? Look, probably not. Why the homocysteine levels low? Mostly it's probably because you might be taking too much folate. If you're just taking the normal amount, don't worry about it. But some people with MTHFR mutations, we've got them on like quite a lot of folate, and sometimes we can then end up with homocysteine being too low, so we've just got to pull back on a little bit. So I don't know whether you're taking megafol or whether you're on heaps of methylfolate, but if it's any of those reasons, then maybe just pull back a little bit. Okay. How increased chances of implantation on Friday? I think we talked about implantation. So Friday, good luck to you. That's fantastic. Okay, this one here. How do I know if I've got endometriosis? Oh my gosh, this is such a good question. So endometriosis and silent endometriosis is just everywhere, right? Now, sometimes there might be symptoms that make us think that, yeah, there probably is endometriosis there, like horrific period pain, really heavy flooding periods, really bad digestion and bowel issues, particularly around the period, you know, really strong bloating, time off work, you know, not being able to kind of function when you've got your period. Very classic kind of endometriosis symptoms. The other sort of endometriosis that I'm sort of seeing more and more. So for those people, if you're not falling pregnant easily, it absolutely pays to go and see an endometriosis specialist. I wouldn't say just a general gynecologist. I've got a few people that I refer to for endometriosis, and they're the only people that I would trust to do a good job. And so with those people, you know, there's a net benefit in having a laparoscopy, which is keyhole surgery, to identify your endometriosis, because you're already in so much pain that even if that didn't help your fertility, there's hopefully going to be a net benefit for the rest of the periods until you're 50 being less painful. There's the other subgroup, and I spoke to one of them today, or maybe one of them today, we'll find out, where they have what I call silent endometriosis. Now, silent endometriosis doesn't have all of those symptoms. It's really hard whether and when to recommend these people to go and see somebody and to consider a laparoscopy, because, you know, they could go and pay $5,000-$8,000 out of pocket on a surgery and then not have endometriosis, right? Now, the people that I recommend, the doctors that I use or, you know, work with, they nearly always get it right. So they'll ask you specific questions and nearly always know. The main reason, I guess, to, like, I guess, you know, think about would it be endometriosis is if you're young, like you're under 35 and you've got a low AMH, and, you know, maybe you're not getting good egg quality in IVF cycles, you know, and or been trying to conceive for quite a long time, I think there's a point where you have to kind of go, do I just do another IVF cycle? You know, maybe you're up to your third or fourth or more IVF cycle, or do I consider what's actually causing my low AMH? So what's actually causing this low egg reserve or egg quality issue? Why, when I'm doing IVF, are they saying the egg quality is not good? The embryos are not progressing well, you know, not getting many, and the quality is not great. Why is that happening? So if you've got early menopause in the family, you're like, okay, well, that's bad luck. That's probably that. If there's no other reason, there's nothing else that we can see what's kind of going on, then, you know, is it endometriosis? So absolutely, if you don't have really terrible period symptoms, you're unlikely to want to have a laparoscopy, which is keyhole surgery, you know, at the beginning of your journey. Probably not many people are going to do that. But if you have done 3 or 4 IVF cycles, low egg quality, and you are younger, it's like, well, what's causing that? And so that's when I would go and get an opinion on endometriosis, because it may well be you do have endometriosis, it gets cleared up, you conceive naturally in the next, you know, 3 or 4 months, and you forget IVF altogether, and you have your subsequent baby naturally as well. I have so many patients in this situation, and quite often they're on the IVF, you know, oh, but I'm just going to start another cycle. I'm like, oh, don't forget to go and see such and such. Like, maybe we should consider endometriosis. And some of them will do that for 6, 12 months, and then they finally go and get a laparoscopy. Now, I'm not saying it's for everybody. Of course it's not. It's abdominal surgery. It's keyhole surgery. But it is something that at some point, it's good to look back if you've done multiple cycles and just stand back for a second and go, what is the information that we're collecting here? Is it smart to just keep doing more cycles on top of each other? Or is there something else going on that we need to look at? Even a hysteroscopy, which is sort of like I won't act it out, but like you're asleep, but they're just going inside the uterus. It's not surgery. It's often done at the same time as a laparoscopy, but it can be done separately, is another reason why there can be implantation failure going on. So some people will have, like either natural killer cells, which are better diagnosed via blood rather than the biopsy. But also too, you could have what's called endometriosis. So you might have an asymptomatic bacterial infection that's causing inflammation in your uterus. You just need a dose of antibiotics, and we'll pump you up with some probiotics at the same time or afterwards or both. And you're like, oh my gosh, like I just fell pregnant naturally after rounds of IVF, or, you know, all this time kind of not trying, no symptoms at all, but the lining of the uterus has been so red and inflamed with whatever kind of bacteria that's there, just needed a dose of antibiotics. So, you know, as you can tell, and probably from these series as well, the way that I work is very integrative. So it's not just about doing it the natural way, but if it can be the natural way, yay, that's awesome. But if not, you know, we want to make sure that we're working with doctors and specialists that are going to be, you know, investigating all these things. And the thing that I find quite common is that if you're 39, 40 plus, you don't really get investigated for too much because it's all just age. It's all just age. It's all just egg quality. And yeah, absolutely. We know that, right? But it doesn't mean that any of these other blood clotting issues or thyroid issues or immune issues or whatever that might have been happening at 35 doesn't mean that they're not happening at 41. So, you know, try not to let it just get put down to egg quality. Yes, if you're late 30s, early 40s, it probably is egg quality, or that's one of the kind of factors that we need to kind of look at, but it's possibly not all of it. Like, we don't know. So make sure that you do get a really proper workup. Medicare has gotten a bit tight at the moment on doing blood tests. So I don't know if any of you have noticed that it is hard to get blood tests done. So there are ways of doing them. Sometimes we have to do them privately. Other doctors will, you know, with the right letter from the right person, they will be more open to doing kind of tests. So, you know, we want to make sure that you've got good people on the team. Okay, Nikki O'Keefe, starting in a second IVF cycle next month. All my fingers and toes are crossed for you, and crossed for all of you, absolutely. Like, you know, kudos to you all, because it's such a difficult journey, you know, and what we thought was so easy when we learned about how babies are made. And look, to be honest, it probably would have been easy when we were 16 or whatever to fall pregnant, but it has become really difficult. And, you know, I think it's something that really takes over a lot of your days, a lot of the month, you know, pre-ovulation, post-ovulation, getting ready for a cycle. You know, so many people sort of feel like they're putting their lives on hold. And so a big part of me wanting to help to educate you guys on this, and this is what's all in my courses as well, is to, you know, get you doing the things that matter, you know, not just stopping all exercise, but making sure it's the right exercise, knowing which diet stuff, so that you're not trying to go on all these forums. You know, somebody asked me today about, and bless if you're watching, hey, about somebody, her hairdresser had told her about a turmeric flush, like a vaginal turmeric flush, you know. So don't do that, guys. Don't put things up there. They're not meant to be up there. But, you know, like, there's just so much, you know, where we're grabbing onto, like, somebody did this and then fell pregnant. Somebody did that and kind of fell pregnant. You know, I know it seems crazy, but people fall pregnant all the time. And, you know, it is difficult for a lot of people. And it's why you do really need to be working with people that you can trust. And it's a big part of why I'm bringing a lot of these specialists for you guys to listen to, so you can work out who you want on your team, because I think that's really important. A lot of the time we just get kind of lumped with the specialist that our doctor referred us to, or our friend up the road got pregnant with, or whatever, but that doesn't mean it's the right person for you and for what's going on with you. For example, if you've got really high natural killer cells, there's a lot of doctors that are not going to consider that as an issue. And so you may be missing out on potential treatment that would be good for you. So hopefully you guys are sort of getting to meet some of the doctors, and I've got some really great ones coming up as well. Chrissy, can you test NK cells? The blood test, I didn't have enough cells when I biopsied with Dr. Lynn. Yes. So the test that Gavin Sachs has pioneered is done via Virtus Health, which is IVF Australia based. You know, so I often refer for that. It is about $300 or $400. So Gavin's sort of, the different doctors have different takes on it. Some don't believe it at all, right? Others, like, so Dr. Sachs, his evidence is that the blood test is more specific because it's a higher quality test. Now, other doctors are still using the uterine biopsy, which they obviously think works the best as well. Now, Dr. Sachs thinks, and I don't know, right? I don't know. I'm just the messenger. His kind of view, which sounds very credible to me, is that the reason why, 250, okay, thank you. It's probably a bit more when I refer. So that's great, thank you. So basically, what his sort of thing is that the test is more specific. So even though the biopsy at the location should be more specific, the test is older and less sophisticated. So it's like, for example, sending a 3-year-old into the room to count how many people are there. It's like, okay, the best way to count how many people are in the room is by going into the room and counting the people. But if the tester is 3, then there could be 20 people in the room, and the tester, this 3-year-old, tells us that there's 100 people in the room. So it may not be the most accurate of tests. Don't know if that was a good analogy or not. So yes, you can do it through blood test. I prefer it through blood test. It's really kind of clear cut. And yeah, $250 apparently. So that's good. Virtus Health. Simi Wellness. Hi, Simi. Is there anything that can be done for follicles that are empty, just went through a cycle? They thought the follicles were okay, but they're empty. That is heartbreaking, because what happens is that they might say you've got 6 or 7 follicles, and then when you go there, they're empty. So an empty follicle, a lot of people, particularly as we get older, will have empty follicles. A lot of my women who are sort of 41, 42, pleasure, Chrissy, 41, 42, they will often have more empty follicles. So it will look like there's going to be more eggs collected, but there's no eggs in there. Now, sometimes it's that the egg was really small or really difficult to get out, and sometimes that they're empty. So you can't make something that's not there, right? So if there's a follicle there and it's small, we can be looking at things to help to support its growth. If there's follicles there and with eggs in them that are sort of a bit over mature because we're a little bit older, you know, in that 3 to 4 months before your cycle, or the 3 to 4 months before you start trying, that's about how long it takes for an egg cell to mature. And that's when we can be coming in with all of our beautiful antioxidants, NAC, lipoic acid, ubiquinol, vitamin C, you know, NAD+, resveratrol, glutathione, there's so many, right? So that's when we can make that difference. But we can't really make something that's not there. So it may be that, you know, they need to change the medication. So if you have had just one IVF cycle and it hasn't been successful, just remember, I always call that a test cycle. Obviously, the IVF doctors don't like us calling it that because it's expensive, but I always call that a test cycle. Now, the reason for that is that it gives us, I guess, an idea of how your body responds to the medication. You know, so were the eggs immature? That may just mean you needed a different trigger or a double trigger. Did you not create enough eggs and follicles? Then, you know, maybe that they need to increase the dose or change the dose, or change you from an antagonist cycle or a short cycle to an agonist cycle or a long cycle. So don't ever go in just thinking that that first cycle is the be all and end all. That's like sort of going, look, say for example, I need to go on an antidepressant, for example, and the doctor says, try this one. Now, you could feel absolutely fantastic on that, or you could feel terrible, horrible, and need to change. It doesn't mean that none of them are right for you. It may just mean that one's not right for you. So if you just had one cycle with empty follicles, try not to take that as in, this is what happens to me every single time. You know, really working on egg quality so that then when you do another cycle, the eggs that are there have as much sort of, you know, mitochondrial support as possible. And I know that so much gets put down to the eggs. It's like so frustrating. But the reason for that is that, you know, an egg is 100 times the size of a sperm. And it's the egg that donates nearly all of the genetic material. It donates all of the mitochondria, which is the energy production center of every cell in the body. So it's the embryo that's responsible really for that cell dividing and growing and replicating. Now, a young healthy egg can also overcome bad sperm, which is like amazing, right? Like what can't women do, seriously, you know? So, you know, if it's a good quality egg, then it'll actually kind of, you know, get the sperm in there and it'll fix up any of the mistakes in the sperm and everything can kind of get going. So as we get older, our eggs lose that ability, you know, just like as we get older, we lose the, you know, we just lose the patience for fixing up all the man's mistakes. Only joking, guys. We love men. We love everybody, whatever you are, whoever you are. You know, so I think it makes it harder as we get older, and a lot does get put down to egg quality. It feels like we're having laparoscopies, hysteroscopies, all these tests, natural killer cells, and then it gets kind of put down to egg quality. The guys go and do one sperm test. It's not even always perfect. They're like, oh, it's fine. It's told it's fine. And the amount of ones that I get, so that people are told that it's fine, and they bring me them, and there's actually numbers in there that are out of the range, is unbelievable. So don't just believe that it's fine. Always get a copy of every pathology test that you get done. You may be with one doctor and stick with them and fall pregnant. Amazing. Hopefully that happens. Or you may unfortunately end up needing to move doctors or asking for a second opinion. So you want to make sure that you get all of your results as you have them. Throw them into your email or a Dropbox so that anybody, you can you know, download them and give them to whatever doctor that you need, or you may end up using them in the future. I think it's quite interesting that, you know, we would get absolutely a second opinion on our insurance policy, or would get a second opinion on, you know, I don't know, like some sort of house inspection, or, you know, if the mechanic was going to be really expensive, maybe you get a second opinion. often just believe them. It's probably not the best idea. I don't know. But, you know, don't feel like you can't get a second opinion with your health and your fertility, because I think we tend to think that, you know, IVF and fertility, you know, it's all the same, but it's absolutely not. Like in every other system of medicine, like in every other job you guys have ever worked in, whether it's teaching, whether it's hospitality, whether it's marketing, whether it's banking, whatever it is, naturopathy, you're going to see different naturopaths and they're going to do different things as well. So there isn't just one way. So, you know, if you're not getting where you want to be getting to, obviously you don't want to swap specialists all the time, but if you've got to a bit of a, you know, brick wall with your specialist, you might have done 2 or 3 cycles, not much is changing, you're bringing stuff up and they're not listening to you, you know, that's a good time to have a change. Okay, so the next kind of question, sorry, so many questions, is, do you need your cycle to be perfect before IVF? Okay, awesome question. No, you don't. So a lot of people will say like, oh, I can't start IVF this month because, you know, I had a really irregular cycle, or I had a 20-day cycle and never had that before. Honestly, IVF's going to come up and dampen down all your hormones and put everything else back into place. And so you don't need your period to be perfect before IVF. In actual fact, it's one of the reasons why people might do IVF. Okay. The next question, stage 4 endo and adeno, ERA, Emma Alice, and dietitian, any tips? Not sure what that means. So the ERA test is looking at the endometrial receptivity. So, you know, are they putting back the embryo at the time when they think they should? In order to do that, you've got to do sort of like a mock cycle and get it all sent away, and it costs thousands of dollars. Most people come back with the endometrial receptivity in the right range, but some people don't, so it can be worth looking at. The Emma and Alice test are looking at any bacteria, good and bad bacteria. So we know we need lots of lactobacilli in the uterine for good implantation. And the lactobacilli is in the multibiotic capsule that's part of my fertility starter pack with the NaturBest, the good quality fish oil, and the high lactobacilli probiotic. And that's why that's there, because it's so important for implantation. So with endo stage 4, hopefully you've had that removed. Adenomyosis is kind of like endometriosis in the muscle of the uterus. Now, it often happens in older women with endometriosis, but can happen in younger women as well. So the only thing that can really help to treat it is there's some things that we can do to help move estrogen down a milder pathway, turmeric, high-dose fish oils, there's some herbs that we use. But, you know, if you're in that IVF setting, they'll often actually do an egg collection, make embryos, then put you onto 3 months of Zoladex, which just shunts all the, it's almost like a fake menopause, to be honest, where they pull all the estrogen out of your system, and that helps to shrink the adenomyosis before they then stop that and then do an embryo transfer. So that's something that's worth talking to your doctor about. Okay, if you don't produce many embryos, do you think PGD testing is worth the risk? Good question. So yes and no, it depends on your everything. Okay, so if you don't produce many embryos, you know, if you're only getting 1 or 2, you know, it may not be worth genetically testing them, because the cost and, you know, they're probably better in you and being touched less and things like that. However, if you had recurrent losses, then they're the people that are sort of like, look, I've had recurrent chromosomal losses and I'm not going to put back in an embryo, particularly when I'm older, that's not genetically tested, because every time that happens, they might get to 6, 7, 8, 9, 10, 11 weeks. And then, you know, really, I mean, not only emotionally, physically, everything, obviously going through a loss is terrible. So if you're testing and you haven't had losses, if you've only got 1 or 2 embryos, I probably wouldn't. If you've got 3 or more, I probably put one back in fresh and test the other 2 if that's an option, just to get a bit of an idea as to why they're not working. You know, so if you're producing embryos and then you're putting them back in and they're not implanting, it's kind of like, is there some sort of immune, blood clotting, thyroid, celiac, blood sugar, you know, insulin implantation issue? Or are those embryos, or was that embryo just not chromosomally ever going to make it, unfortunately? So doing a round of PGD testing can actually help to identify whether that's the case. You know, so if you had 3 embryos and you tested them, they were all genetically abnormal, one, you'd save your heartache and time and money putting them back in. So that's a bonus. You can start on with your next round. Also, too, you might know why other cycles haven't worked. Conversely, if you had 3 and they were all genetically perfect, it's like, hang on a second, if these were all genetically perfect, then why have my embryo transfers not been working? You need to really investigate all of those other things. Okay, we're about to run out of time. Danny, hey Danny. Okay, if an embryo is PGD tested and considered all good, can you have confidence in this, or can there be other things happening in the background, like sperm issues that can contribute to pregnancy loss? So PGS tested, Richie Gal, that's the Med Lab multi-gen, but it's only in that fertility starter pack. So it's just a non-practitioner only one. So it's in that fertility starter pack, which is on the first page of my online store. So Danny, so if the embryo is PGS tested, it means that it is chromosomally fine. It doesn't necessarily mean it's going to work. There can be other issues with the embryo that we didn't know about. There can be issues with, you know, the blood flow, you know, immune issues and other things as well. So it's probably not so much like sperm issues in that sense, but probably some kind of other sort of, you know, issue environmentally, and or, you know, it could be chromosomally tested. It's got lots of chromosomes, but there's something else happening or not great with the embryo that's kind of caused that to happen. But, you know, I wish I had more answers. Okay. High AMH, you're going to be really quick before we run out of time. Is it bad to have high AMH when doing IVF? I thought this would be positive, but I've heard the opposite. Look, it's better high than low. They just have to be really careful not to overstimulate you. So you're probably going to get a higher percentage of eggs that don't work, just because, you know, you're going to have lots of them. So they're not all going to be perfect quality, but at least you've got eggs there to work with. So that's fantastic. You'd much prefer high than low. And the doctors are really good at not overstimulating people. All right, so we've got to draw to a close because otherwise Instagram will cut me off after an hour. So thank you so much for joining. I know that nearly all of you stuck with us for the entire chat. So I really appreciate that. As I said, next Thursday night at 7:30, we've got Dr. Natasha Andreadis. She is great. Her Instagram is Dr. Tash, the Fanny Mechanic. Love it. So she's got a really good sense of humor. She's super into all of this sort of stuff, and she will love hearing all of your questions as well. She's really good. So don't forget, you can jump in. So the special on my online courses is still on. To be honest, $129 for them is an absolute steal, because like I give you all that information in clinic for, you know, more than double and triple that price. So it's a good way to have all that there. Beautiful recipes, meal plans, what to do for, you know, sleep, meditation, mindfulness. There's meditation tracks to download, all the diet stuff, everything you need to know. You can also jump onto the website and grab that fertility starter pack too if you're interested. Thank you so much for joining me on this, well, if you're in Sydney, rainy, cold, dark night. Thank you for, you know, dragging yourself away from whatever else you were doing. Sending you all lots of love, lots of baby dust. You know, please let me know when you guys do fall pregnant. The people that send me in babies and pictures and things like that, it's just kind of like so special. Oh, thank you, Nagoya Doula. The course is fantastic. Thank you so much. So I'm glad that, yeah, we've had lots of great feedback from it, which has been really exciting for me. So I made it for you guys. So jump in and have a look. The link's in my